Hi there. I'm Regenia Stull, and I would like to welcome you to the Heart of Health and Science podcast. Today, we're going to be talking about men in healthcare, and it's a topic that's really near and dear to me and many others in healthcare because we need so many people in healthcare with talent, with varying degrees of abilities, with varying degrees of knowledge and interest that come together in healthcare and make it as dynamic and as professional and as exciting as it can possibly be. I'd like to start out by giving you a few statistics about men in healthcare that I found to be really surprising, and I think you will too. The number of male registered nurses has increased from about 140,000 in the year 2000 to be 400,000 in the year 2023. This means that about 14% of nurses are now men, which is up from about 9% 2 decades ago. That's a huge improvement, a huge growth of men coming into healthcare, and in that statistic specifically into nursing. Now, when I first went into healthcare, I came fresh out of high school, became a CNA, worked in a hospital, worked in a nursing home, and it was primarily women in both of those areas. The only men that I would see were the physicians or men coming in carrying in heavy boxes, and then they would leave again. It was primarily the physicians that I saw as men in healthcare, but that is very much changing. Now, when I come into work, I see men in security. I see men at the front desk. I see men in administration, in accounting, in nursing, in all areas of clinical, in sports medicine, in physical therapy, in the clinic setting. Men are coming in everywhere in healthcare, and it's making us even better because they have a different way of thinking, a different way of approaching than a predominantly female organization, and we're just coming together and it's making us better. And when the healthcare workers are better and the environment is better, the care is better. So I am just so excited to be able to introduce our guests today and let them tell you a little bit about themselves, and then we'll launch into a discussion. So Jordan, I'll start with you.
Hi, first, Regina, thank you so much for inviting me to your podcast. Again, my name is Jordan Jackson. I am the STEMI coordinator at Liberty Hospital, and I've been in healthcare for about 16 years, and I love it. So, yeah.
Great. Could you tell us a little bit about STEMI coordinator? What does that mean?
Well, I'm a very small cog in a big machine, so I'm honored to work with lots of talented individuals, and our goal is to help patients recover from heart attacks. It's to help first responders respond to heart attacks and everything in the cardiac world. So for those of
our listeners who are not in healthcare at all, STEMI might be a plant. It might be a STEM. Tell us a little bit about that.
Yeah, absolutely. STEMI is ST elevated myocardial infarction. It is the ST segment on an EKG during a heart attack is elevated, and that's what alerts us to know that there is damage that's occurring to the heart. So a patient may present to the hospital with some chest pain. It's our job to determine if that chest pain is a heart attack or if it's another cause. And so we rule that out. And it's a time-critical diagnosis program where minutes, seconds even, are very important. And so we train and train and train to be as quick as possible. And I'm proud to say we're really good at saving lives. And I think we make a big impact in the community. So.
Yeah, it's really interesting, the work that you do. I have the opportunity to come into meetings and see data and the quality outcomes that you provide. And it's just astonishing. Lives are being saved because of the work that you and your team do, which is, I mean, hats off. Hats off to you. It's great work that you do.
Thank you.
And also today we have with us Adam. Could you tell us a little bit about yourself?
Yeah, I'm Adam Long. I've been a strength and conditioning coach for like 20 plus years now. I've been kind of all over the place as far as different sectors go. So I've been in a high school sector. I've been in the collegiate sector and been with Liberty Hospital since 2014, once our sports medicine clinic opened up.
So what does it take for a person to be able to come in contact with you? I mean, sports medicine do you have to be in sports and have an injury and then meet you? Or how does somebody come in contact with you? So
it's a really cool thing, in which I was so excited about back in 2014 when I found out the facility was opening up. It's kind of one of the only places in the Kansas City area, north of the river especially, that focuses on outpatient physical therapy, so the sports medicine portion of physical therapy, We have athletic training services as well. Athletic training, we can get into that a little bit later, but the athletic training services are the athletic trainers cover injuries from schools. So they're the ones that you see on the sidelines with the little fanny pack. They're taping ankles. They're the first responders to the injuries. And then we also have strength and conditioning coaches at the sports medicine clinic, and that's kind of where I come in. I deal with probably 90% of healthy individuals. The other 10% are coming off of physical therapy, that they've kind of graduated from physical therapy. So I'm just continuing to help them on their way back to whether it's their sport, whether it's their activity over the weekend, or just living a pain-free life.
Now, I know that there are a lot of young people who are interested in looking at physical fitness or looking at physical therapy, and perhaps now sports medicine.
Yeah.
And they're also fans of the Chiefs.
Yeah.
And all of us have seen players limp off the field or be carried off the field. So let's say a player of any sport gets injured. How do they ultimately make their way to you? And aside from the overview, what types of things do you do with them to help them get back to that place of wellness? So
I would be seeing these patients way down the line of their care. So obviously they're getting with an orthopedic surgeon most of the time. If surgery is needed, surgery is taken care of, and then they'll be with their physical therapist sometimes for a long time. Yeah. So we're able to do that transition from physical therapy class, where at our facility, the injured athlete will be under direct care of myself, but I'm kind of under direct care of the physical therapist. You know what I mean? So the physical therapist is there kind of programming their rehab and their strength training. So earning the trust of the physical therapist over at our clinic, I think, has done wonders just for our program. You know what I mean? Because they know I'm going to listen to what that patient needs, and they'll also listen to what I think as far as the strength training goes. So it's a really cool model, and we've had a lot of success with athletes getting back to the field a little bit quicker because of that model.
That's amazing. Yeah. It truly is.
It's a lot of fun.
And it sounds like everybody is very vested in the success of this patient.
Very vested.
And their success is your success, right?
Absolutely.
So while I'm talking to you, I'm just going to continue picking your brain. And then, Jordan, you're not out of the hot spot. Coming back.
Okay.
So how did you get into a hospital setting versus that high school setting or the collegiate setting that you were talking about? How did you end up at a hospital setting, and which is your favorite?
It's been wild. Like, really, when I got out of grad school, I was a graduate assistant at Northwest Missouri State. So I decided to do my graduate assistantship at Northwest Missouri State. So good thing with that was I got a lot of valuable experience right away. I learned the collegiate sector right away, training multiple sports, just working on trying to obviously prevent injuries as much as possible, getting the athletes stronger, more explosive, and become better athletes. After grad school, I went the high school route. After that, I kind of went the collegiate route. I was able and fortunate enough, I worked at a university out at Golden, Colorado. So my wife and I, after we had our first child, wanted to put roots down. Always loved the Kansas City area. My wife's from the Kansas City area. We just decided to move back on a whim. I love the hospital setting because it's not nearly as commercialized, so it's not as much like I don't have to charge to keep the rent on. You know what I mean? Like, we're trying to obviously make sure we're covering costs and things like that, but more so than anything, it's about patient care. And then, like I said, in the summer now, we've got athletes coming back. So I think the best thing about being in a hospital setting is the diverse population. And I got to say, I love the hospital setting.
So do any of the patients that you have, or the clients that come to you, have they started out not in physical fitness, not as an athlete, but perhaps being ill, that maybe Jordan has been able to see, and then as they're going to recovery, they start out with physical fitness, physical therapy, and then go into strengthening, which leads them to you?
Absolutely.
So,
big majority.
Okay.
Yeah,
okay.
big majority.
So I think that's one of the amazing things about healthcare is that at the point of entry that a person walks in and becomes a patient, then doors are open to a whole new world to them that they likely didn't know existed. Right. So, for example, to you, Jordan, a person could be at home having this weird chest pain, not sure if it's cardiac or muscular. They wait. Then finally I'm in trouble. I need to get an ambulance here. Right. Ambulance comes, you get a call.
Yeah.
So walk us through what happens when you first get that call. And then let's just go from when you get the call to when your part's done.
Sure.
And then we walk right into Adam and the part that he gets to do.
So, I respond to all STEMI activations, Monday through Friday, I guess, in the daytime. So what happens is the patient calls 911, ambulance goes and picks up the patient. As soon as that ambulance driver, as soon as the paramedic gets there, they're going to start the clock. And that is what we're looking at, is how long did it take that ambulance to get to the patient? And they're asking things like, when did the symptoms begin? They're hooking them up to an EKG machine. They're checking, is this a STEMI? Is this a non-STEMI? Or is this something that is maybe epigastric? There's all they're going through the motion. Is this even cardiac? So so they're going to be as quick as they can getting that patient to the hospital. And one of the things that we do is we have really good communication. So our emergency department, they get the radio message from the paramedic, and they are alerted that a STEMI is coming. That activates our on-call team, which alerts our interventional cardiologist to be prepared and ready. And by the time the ambulance gets to the ER, everybody is suited up and ready to go, because we all know that timing is everything with these patients. So we then immediately get that patient onto our hospital stretcher in the emergency department, and we start asking questions really quickly. What's your history? Do you have comorbidities for this? What's the likelihood of this being a heart attack? And then we're also simultaneously checking our EKGs and verifying with EMS that this is a heart attack. And so it all happens very fast, very quickly. And so from there, we're going to take that patient, if it is a heart attack, over to our cath lab. And our cath lab is where our interventional cardiologists and our amazing cath lab teams get to actually perform invasive procedures, minimally invasive procedures. They're really good at saving lives in there. And
it's amazing.
It's kind of a whirlwind. Yeah. And so my part is to be present, to look at any fallouts, any areas of needed improvement. I want to be the voice for any of these healthcare workers that are frustrated or can see an improvement or know that they need a little bit more reinforcement in certain areas, whether it's education or whatever. And then I can meet with a multidisciplinary team after the case is over to discuss those things. And it's always about improvement. How can we be quicker, faster, save more lives, be more efficient? And then we also follow that patient on the back end throughout the process. We have a problem, in the United States of about 600,000 new heart attacks occur every year, and 200,000 of those will go on to have their second heart attack in that same year. So we're really good at saving lives. Our 911 alert systems, our paramedics, our first responders, they know what to do when they're going to do it. The challenge with the STEMI program is, how do we prevent that patient from being a return patient or having another heart attack? We're getting them in, we're talking to them, we're saving their lives, but at the end, we're saying, okay, you need to change where you're eating, change how you live, change your activity levels. And by the way, you're going to be on a handful of different medications that all have side effects. And, let's get you off to physical therapy and rehab and try to help improve your heart. But it's a lot of work after the hospital too. So we're always looking for ways to improve. So
now, do you stay in touch with the patients for a period of time?
Do
they call back, ask you questions about what happened to them or what they should or shouldn't be doing?
Sure. Our care management team reaches out and follows up with them. We make sure that we have follow-up appointments scheduled throughout their post-care. And we also, we're going to save their life. We're going to admit that patient, make sure they're stable. But afterwards, we're going to make sure that they get cardiac rehab. And cardiac rehab is really important. It's where you can take an injured heart that can be considered a heart failure, and you can really bring up their ejection fraction and make them healthy again. And so we have amazing physical therapists, cardiac therapists that work with them. And like I said, the care management team follows up whenever the patient goes home to help answer any questions. So, yeah.
Yeah. So two very different roles that you play that definitely can converge at some point for that patient.
Right. Yeah.
Have either of you had mentors in the field that brought you to where you are, or caused you to really become interested in the field that you're in? And if so, maybe talk a little bit about what made those mentors stand out to you a little.
Oh, sure. Yeah, I think so. I think the mentors that I experienced were the physicians and colleagues that I worked with. Yeah. Healthcare wasn't something that I originally sought after. It was something that I kind of grew into. I never really thought I would be a nurse, but I started off as a patient transporter back in my early 20s, and just started talking to folks and saying, what got you into healthcare? Why are you a surgeon? Why are you a nurse? And
Great conversations and questions, that's
yeah,
for sure.
exactly. And along the journey, I spoke to people who were impressive. People that I thought were really smart, people that I could see making impacts, real life impacts in patients' lives. And that always made me want to gravitate towards those people. And so it kind of like I got sucked into the healthcare world because of just an awesome group of healthcare workers, bosses that have kind of nudged me along, reinforced, hey, you need to go back to school. We need to maybe, you're doing a really good job here, but let's advance your career a little bit. We could really
more
use
doors
you.
for you.
Yeah, exactly. So yeah, I've had multiple mentors. Very thankful for that. And I help try to be a mentor to other people as well because of it, because I know how important that is. So yeah.
Yes. How about you?
Yeah, my mentor is probably my good friend, Joe Quinlan. He's the head strength conditioning coach up at Northwest Missouri State.
Okay.
Probably the biggest reason is I did my internship with him. He was in the Maryville area when I was an undergrad, and we would go from town to town. He had these speed and agility camps that he did with high school, so I was actually helping him coach when I was still an undergrad. So I learned kind of the ropes of coaching from him early on. The reason why, I liked him so much and how much he helped me so much for numerous ways, both as a person and as a professional. He worked with a very wide population as well, very diverse population. So he was actually, before he was the strength coach at the college, he was at the fitness center, at the wellness center in Maryville. So he had, a senior class that I would go help with and work with all the older ladies, you know what I mean? And they absolutely loved him. I saw that. He worked with a young man for a long time that was in a very, very bad car accident, was in a wheelchair, had very severe injuries, worked with him for a long time. I was able to see that, and I actually get the opportunity to work with that young man now because his family moved to the Kansas City area.
Oh,
and
wow.
Joe contacted me, and I've never worked with somebody that literally, like, I am one-on-one with and, up close and personal and have to help transport him places to places. He can't.
Yeah, it's very different.
He can't communicate with me exactly what's wrong, so it's very, very different. But I would say Joe has just done wonders for me professionally just because of being able to be adaptable and being able to work with a very diverse population. So he's
Keeping that end goal in mind.
100%, yeah. 100%.
Yeah. So I know that oftentimes when people come into the healthcare setting, they oftentimes think, okay, I'm going to have to go, men especially, they think I'm going to have to go in, I'm going to have to tell all of my personal things to this female, and it's going to be awkward, and I just don't want to talk to a female. I wish there were more males that I could talk to. Have you encountered that at all, that people come in and they're so relieved that you are there as opposed to, in this case, a female, because they're just more comfortable talking to you? Maybe not you as much, Jordan, because especially in the role you're in now, because they're just so happy to see that knowledge base walk in the room to save them.
Sure.
But when you were working as a nurse in the emergency department, I'm sure you had plenty of opportunity for people to say,
Absolutely.
could I talk to a man? Could I talk to a woman?
Absolutely. There are, men, I think we're more stoic. We are a little bit more private whenever it comes to health issues. We're supposed to be, rough and tough, and nothing, breaks us down.
Nothing rattles you.
Yeah, nothing rattles us. And so, yeah, absolutely. There have been those times. And even when the person isn't the patient, I've seen men who have children or family members that they're bringing in maybe after a trauma or, just anything into the emergency department. And you can tell they're holding up their emotions for the sake of their family. And several times I've seen maybe their family member goes off to radiology, and the father or husband, they'll open up to me and they'll kind of let their guard down. And I can tell is easy to talk man to man with them. So yeah, that does happen.
Yeah, that's a good point. That feeling that they need to be the strongest one in the room, or they need to remain stoic, maybe dissolves a little bit because they can't talk man to man now.
Absolutely,
it's a really good point. It's a point that really makes it even so much more important that more men come into healthcare. There's just so many things that men bring to and can do in healthcare. Is there anything on the horizon that you see in healthcare, whether it's men or women, or new programs, products, more things coming that is exciting to you, that you see coming?
Yeah, I mean, in the cardiology world, technology and AI is insane.
It's exploding.
It's impressive. I mean, we're going to be able to have basically computers that can predict using algorithms if a person is having an underlying dysrhythmia, noticing heart attacks before the human eye can discern those, and alerting people that this is happening. There's this company that I've been kind of following. I won't talk about what it is, but there was a gentleman who was flying from East Coast to West Coast, and as he was going over the Midwest, a pager that he was supposed to wear went off because he had an implanted device that could detect very sensitive changes in enzymes and troponin levels in his heart.
Wow.
So while he was asymptomatic, he had to alert the pilot, hey, we need to land. Something is going on.
Wow.
I've been advised to give you this information. Sure enough, he came to the ER and he said, hey, listen, this device went off. I feel fine. And the nurse actually watched him slowly start to have a heart attack in front of her eyes. And so that technology is just impressive. There are things like they're looking at pacemakers and being able to charge them wirelessly so that you don't need to have them replaced. Looking into genetics to find out which drugs work for certain people for anti-coagulants. And I think, even with data collection, we're finding out that family members and, who have heart disease translates to children, then you can target care towards those people and it's just more efficient.
Yeah.
So there are a lot
It's
of things I'm
exploding.
excited about. Yeah, it's going to be interesting.
AI has it's getting kind of a bad rap sometimes because it's the artificial intelligence and it's scary, it's the unknown, but it can do things like that, and that's remarkable. And that example, it was used. It said, hey, you have an emergency coming, get ready, and people are waiting for the emergency to happen. That's incredible.
Imagine? That's wonderful. Yeah, I can't wait. Every day it seems like I feel like new treatments, new methodologies for caring for people.
I wish we could just adopt them all immediately, right?
Yeah, exactly. Yeah, it's like, when is it coming? Let's start it now.
Yes. Anything new on the horizon that you're aware of in your world?
I think the biggest thing is just the knowledge that people are gaining now with preventative care. You know what I mean? I think that's
you're right.
very, very important. I always joke with the kids and saying social media is such a double-edged sword because there's so much good information out there. You got to find it, you know what I mean? Because there's a lot of bad information out there too. But there's so much information about how important eating healthy, eating whole foods, exercising is great for preventative care. You know what I mean? Just like unbelievably great. You know what I mean? But again, it's a matter of just getting people to understand it's very, very simple. It's just not easy. You know what I mean? And I think that's the hardest part.
And I think there are different things that bring people to that.
Totally.
I did not grow up in a family that loved going to the gym and, biking or whatever that exercise was. But probably about 9 years ago, I developed a weird food allergy to MSG. And 3 pages worth of additives and the preservatives.
Oh, yeah.
I have an anaphylactic reaction to
Really?
MSG.
Oh, wow.
So I carry an EpiPen with me all the time.
Wow.
That took me on a path to clean eating.
Yeah.
And I'm really kind of afraid to eat out.
have to
I
be.
make everything and I'm really, really
Totally.
careful. It's amazing the products that have MSG, which, is actively trying to kill me, is the way I word that.
Right.
But once you start doing one thing different, in my case, it was that clean eating and really paying attention, then that takes you to the next stage.
Totally.
And, now I have a Peloton and, I'm jumping on that at night. I don't train like the crazy people.
No.
And, I don't have those screaming coaches in my head or anything, but it's transformational.
Yeah.
It prevents me seeing you in a whole different capacity.
Yes.
So anything I can do on one side of my life, preventative or to slow things down or speed up, whichever it needs to be, to prevent interacting with you on a different level than colleagues, I will do that. I will do that.
I like seeing you on the podcast, not as a patient.
So, okay, I'm going to bring us to my favorite question. Of every time I get to meet with people and talk with people on our podcast, I have one final question, which is, can you share today a favorite story from your career that really highlights why you love doing what you're doing? Off the wall,
Okay.
funny, serious, just your favorite story.
Oh gosh, there are a lot. There are so many. One of the most impactful, and I'll talk about this community. I've worked in different states and different facilities, but we had a patient that came in and she was having what we call a SCAD, or a spontaneous coronary artery dissection, and it usually happens in women who have just given birth. I'm not a physician, so 3 to 5 weeks afterwards, they're at risk. And sure enough, this patient had a heart attack because of it. And so we did our thing, as we do, and she had a good outcome. Pete Van Ness from the Liberty Fire Department reached out to me a couple of months later, and he said, "Hey, Jordan, that patient would love to bring her family up to the firehouse, and we want to include Liberty Hospital staff as well. We'd love to see you there." And I thought, okay, that'd be great. And I remember looking at the mother holding her baby and her family, and they looked at me and shook my hands, and you could just feel that I was a small part in creating life and longevity for this family. It was so impactful, so moving. That
Wow.
every once in a while
was.
I think about that, and it reinvigorates me and makes me still try as hard as I can. So,
It brings you back to your why
absolutely.
every time.
Yes.
Wow. You changed generations in that moment.
Yeah.
Wow. Do you have a favorite
Yeah, I can't
story?
top that, right?
I'm sorry. I'm so sorry.
My favorite story is, like, I just come into work every day. And I'm not like sitting on my high horse, but I take myself for granted. I get so many people that come up to me and say how appreciative they are.
Yes.
You know what I mean? And like, I try to explain to them, and I 100 truly believe this, that it's all up to them. You know what I mean? Like, I'm giving them a balanced program. I'm giving them a place to come train at safely, under a watchful eye, making sure they're doing correct things. I push them when they need to be pushed, pull back when they need to be pulled back. I try to explain to each and every one of them that it's 100% up to them. They always leave with a smile, so that's huge. You know what I mean? So being able to see that, and being able to know, like, even though I honestly don't think that it has anything to do with me, we're here to help those people, and a lot of our people really feel gratitude towards us for helping them get back to being pain-free, hitting certain goals, being able to just play with their grandkids, you know what I mean? Like, being able to help with that, you know what I mean? Even though I don't honestly feel it's me, they have gratitude towards us, so I think it's pretty cool.
Well, you're part of their story.
Right, 100%. So I think it's pretty cool to be able to, quote unquote, touch so many people's lives. You know what I mean?
awesome.
Yeah, so it's fun.
That's what we do
Yeah.
in healthcare. I often tell people coming in new employee orientation, for example, that it's not just coming to work and just doing a job.
Right.
It's about becoming part of a story. And what we do will be part of someone's memory forever.
Yeah.
And it's up to us to make that a good memory or a bad memory. And we have the ability to do either. And that is not a small thing.
Right.
It's not a small thing.
Yep.
You will be with that family forever. You will be with all of the Charlies and all of those athletes forever.
Yeah.
And it could be in a good way. He brought me from point A to point Z, or it could be he kicked me hard. It might not be the best thing for them that they feel, but it was the best thing for them, and you got them back to life, and that to their life, and that is not a small thing. There's nothing that compares to healthcare.
Right.
Nothing. And I am so grateful that I'm in it. So, any closing words that either of you have for anybody that's considering maybe coming into healthcare, or get them to run to it?
Sure. Be open-minded. I know that's kind of, cliche, but really be open-minded. If you have somebody that is in the healthcare field, reach out, talk to them. There are so many jobs, and I didn't know how many jobs that there were until I kind of took that first initial step and got a base entry-level position at a hospital. And you can do anything. There's nothing that's stopping you from from working in any field in healthcare that you want, and you will have an impact. And it's something that you can lay your head at night at the end of the day on your pillow, knowing that you did the best you could for humanity. And
you did
that's
good.
a wonderful thing to have in your career. So
Yeah. How great is it for your last thought to be, I did good today.
It's wonderful.
Not just well, but I did good
Right.
today.
Right.
Yeah. Any closing thoughts?
Yeah, I think anybody that's been to a sports medicine clinic or has kids or has been to a ball diamond on the weekend and knows how crazy youth sports is, sports medicine is going to be around, and it's growing. Like we've talked about the sports in college now with these kids getting paid. I mean, youth sports isn't going to get any less nuts. You know what I mean? It's going to go crazier and crazier and crazier. So there's going to be a big need for strength and conditioning coaches, sports medicine, physical therapists, athletic trainers. And I think you're going to just see a lot more of that. So anybody trying to get into the strength and conditioning field, there's going to be a lot of options for you. And like I said, I love the healthcare option of it, just because of the diverse population you get. So it's so much fun for my day to change, and being able to see different populations and help them with different goals. So I think that's probably the biggest thing. But again, like, it's going to be growing more and more, and there's going to be more options. There's going to be a lot of opportunities.
That makes a lot of sense, actually.
Yeah, definitely.
Ever have a boring day?
Snow days are kind of boring.
Yeah.
When people don't want to get on the
Super
road.
rare.
Snow days. Yeah.
Yeah, it's rare.
It's rare.
You never
You're
know
right.
what's going to walk in.
You're right.
Yeah.
Yeah, no doubt.
Well, I believe that will bring us to our end. This has been a great discussion, not only about men coming into healthcare, but about all of the different things that healthcare offers for a variety of people. It's not just nursing. It's not just pharmacy.
Right.
It's not just medicine. There is a whole world open that's in healthcare out there that, to your point, Jordan, that all you have to do is come in and ask, talk to people. And if you know someone in any factor of healthcare, talk to them, find out, what's there, what could I connect with, what could I do? So thank you for coming, and thank you for our conversation.
Yeah,
Appreciate it.
And as always, thank you so much for coming and listening in on our podcast today, where hopefully you have some thoughts now that you could come into healthcare differently than maybe you thought before. If you have any ideas or any thoughts that you would like to have us talk about in our next segment, just send those in to us at Liberty Hospital, at TikTok, at the Heart of Health and Science podcast. We are available. And we want to hear from you, any ideas that you have. So until next time, have a safe life, you have a healthy life, exercise, pay attention to your heart, and be well.